Welcome back, everybody. It's 8:23. It's President's Day. Many of you are at home, and we have some actually important health news. And trying to clear the confusion, which will only create more confusion. Here's Dr. Ahluwalia, the new dietary stuff.
And especially with the cholesterol, my goodness.
Right. So, we've been harping forever. Cholesterol is bad for you. It's going to cause heart disease. Don't eat it. Eggs. So the data over the years has been gradually building up to the point where we're saying that not all cholesterol is bad. Not all fats are bad. And I think we've discussed this in the past too. So what's different now is that the guidelines are changing a little bit to say it's okay to eat egg. It's okay to eat shrimp because these things have cholesterol in them. But the main thing to remember is there's two types of cholesterol. There's the HDL and the LDL. And the HDL is good for you, the LDL is bad for you.
Now.
Yeah, for now.
But that's what we know. Mm-hmm. And even though we're saying it's okay to eat cholesterol, this mostly affects egg, shellfish, and maybe some other few foods.
What about things like cheeses?
No, any fat that is solid at room temperature is saturated fat, mostly.
So that's bad.
That's still bad.
But aren't we, I don't want to confuse the issue. There is a school of thought that says eventually we'll sit here in 5 years and say saturated fat has not been the danger that we thought it is. I mean, it seems to be going in that direction.
You know what? We don't know the answer to this. Alcohol is good for you. Alcohol is bad for you. Fat is, but we've never said actually that fat is good for you. Right. This is the first time that we're sort of giving a little bit of room to say.
And we're saying that the external cholesterol is not the issue. Your body creates cholesterol, but your body has to create cholesterol.
So you need cholesterol for hormones. You need cholesterol for multiple processes in your body. But the body also is able to regulate the cholesterol. If you eat more from outside, we don't produce as much from inside. So we are able to regulate it. But the saturated fat is what we think is the bad stuff.
And just real quickly before we go to the next topic, I know moms out there, I want to know, well, how many times a week can my kids have eggs? That's the thing. Once a week, twice a week.
Right. We don't know the answer to that, but we are saying it's not as bad. You don't have to keep eating egg whites. It's okay to eat a whole egg.
The yolk.
Yeah.
Okay. Sorry. Yes, go ahead.
Mediterranean diet.
Still good, right?
Please, that is the only thing.
Contrarian saying when a lot of us were not eating egg yolks, you throw out the yolk. They say you're taking the healthiest part. It is the nutrition factory within the egg, and you're throwing it away.
Yes, but again, common sense stuff. Don't eat 20 eggs in a week. Have a few. I think you'll be fine.
Your hips are yours, right?
My hips still are mine.
Those are your hips, and they're still working.
I believe so. I believe they are.
But the number of people getting hip replacements up, right? And younger people.
Yeah. So, hip replacement surgeries are very successful. I do them a lot, and people are just doing amazingly well. What we've realized, and we know now, is that hip replacements have almost doubled or more in the last 10 to 15 years. And what's most surprising is that the hip replacements in the younger population has increased even more. And some of it may have to do with the fact that, maybe we overuse our joints and they're failing.
We're exercising too much?
Well, we're running. We're doing things that no generation, this is the second generation that runs regularly.
Right. Not only that, but I think that our tolerance for curtailing our quality of life is less.
Right.
Yeah.
So we don't accept the rocking chair.
So when we used to have people before and we said, just don't run or just,
I want it fixed and I want to do it now.
So people are more aggressive in trying.
And that's what you do, right?
So it's good, but there are a lot of questions about knee surgery.
So the research is evolving, but we're doing a lot more knee surgeries as well. And, I think that, the cane and the don't do a lot doesn't work for people anymore. We have people who go play golf, a month later after.
You have people who are now 65 years old who grew up in the world where you went to the gym 3 times a week. That never, ever existed before.
Exactly.
That's all brand new.
Exactly. So we eat a lot, we exercise a lot, and then we get joint replacement. It works for everybody.
And it's good. It keeps you in business.
Keeps you in business.
And,
chronic fatigue syndrome. This has been such a thing over all these years, and now it seems like doctors are really starting to take it seriously, or at least more seriously than they had in the past.
So it's a problem, as we were sort of joking before. When you say to someone, I'm just tired all the time, everybody says, I am too. What's the big deal?
Right.
But this is a real deal. It's a real problem. Somewhere between 1 million to 3 million Americans have chronic fatigue syndrome. And it's very difficult to diagnose, very difficult to treat. We don't know why it happens, but it's real. So someone who has new onset, mostly fatigue, but, sort of sleepiness and tiredness, that is not affected by rest, doesn't get better with sleep, is worse when they do any kind of activity or think hard or get emotionally stressed. they decompensate. They're not able to function. We talk about people who hold a cell phone for 5 minutes and feel like they're worked out and can't hold it up.
Is it psychological or is it physical?
No, there is some physiological basis to all of this, because when we work with them with exercises and some cognitive behavioral therapy, both, it gets a little
better. If we were
better.
having this conversation 20 years ago, we'd be saying Epstein-Barr syndrome. Then chronic fatigue syndrome. Now there's another name that nobody's going to get. What is that name?
Exertional.
Why don't you say it, Steve? Because clearly you know what it is.
No, I don't.
You don't?
No, I saw it. Exertional,
I thought this was one of those
mechanical. No, it's
Steve's like, let me say it for you.
It's where you want to like punch medicine for coming up with names like this.
So you know why we did it? Because
What?
chronic fatigue syndrome has got such a bad rap.
And it sounds like some people treat it like a joke.
Exactly.
Yeah.
So we wanted a more technical name, which even I don't remember now.
It's a stupid name. No, come up with a simple name so people can relate
But we also
to
want
it.
to look smart. I'm not looking very smart right now. But
No, it is. It is. I would ask the two of them because they're on their iPhones, except they're giggling with each other.
systemic
Yeah.
exertion intolerance disease.
There you go.
Is that what it is?
Yes.
That's what it is.
Come up
Is there
with something
medication for it, or it's just what it is?
So behavior therapy, some graded exercise, and pacing yourself. That's all we know. So it could be post-viral, it could be autoimmune. We have no idea.
Watch your nutrition. Get sleep if you can.
And get a hip replacement if your hip really hurts.
Meditate and learn how to. Is it too late for them to turn back on the new name? Huh?
Yes.
Oh, it's a
done deal.
It's a ridiculous.
It's a done deal.
Yeah, we want simple names like Dr. Sonu Ahluwalia. Thank
Yes.
you, Sonu.
Always
good
great
to
to see
see
you.
you. Yes. All right, it is one of those moments.